This is Christine Porter with the Times News. I'm here today with Dr. Shawn Mendonca, a urologist with Lehigh Valley Health Network. We are talking about the different types of incontinence in women.
There are many different kinds of incontinence, but the ones that I see the most frequently are stress incontinence, urge incontinence, or some people call it overactive bladder. And then there's a third type of incontinence called overflow incontinence. Stress incontinence is incontinence. The symptoms that patients experience are leaking when they cough or sneeze or exert themselves or do some kind of strenuous activity. That has to do with the weakened urethral resistance. The purpose of the urethra and the sphincter around the urethra is to hold the urine in, but over time it gets weak. There are many risk factors, but if it's weak, women leak with, as I stated, with coughing, sneezing, and exertion. Then there's another kind of incontinence called urge incontinence. In normal physiology, when the bladder is in a state of filling, as urine fills the bladder relaxes and it's supposed to expand. However, in women with urge incontinence, the bladder doesn't necessarily expand, and sometimes it even contracts sooner than we want it to. Normally, when you pee, when you urinate, that's the time when the bladder is supposed to contract to expel the urine. However, in women with urge incontinence, the bladder is contracting at an inappropriate time, at a time when we don't want it to contract. And it'll be like you and I are conversing like this, and then suddenly women are like, oh my God, I have to run to the bathroom right now. If I don't, I'm going to have an accident. And we see that problem pretty commonly. Another final type of incontinence is something called overflow incontinence. This is when a person's bladder doesn't function at all. Over time, the bladder fills and fills. These are patients with spinal cord injuries, or they've maybe had recent spinal surgery, or multiple sclerosis, advanced stages. There are many, those are the typical type of patients I see with this kind of incontinence. Their bladder fills and fills and fills, and it gets to a point where the bladder is completely full, but the bladder doesn't really contract. It's just that at some point it reaches a point where it's so full that these patients just leak little amounts of urine. So those three are the main types of incontinence I see. You can have one or both, or rarely you have all three, but especially with stress, if someone has stress incontinence and someone has urge incontinence, we say those patients have mixed urinary incontinence.
I see. It isn't something that probably a lot of women even share with their spouse.
Yeah, absolutely. Yeah. A lot of women also that experiences leaking stop having intercourse with their spouse because they're afraid of leaking while having intercourse. And they don't realize it's a quick fix. Well, not a quick fix, but it is, in the grand scheme of things, a minor surgery with the, just gotta recover for 1 to 2 months. Mm-hmm. And you can go have a normal life after that. So I've had patients like that in the past.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.